Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Hey Tom, good to see you today.
A little unique today. We're recording on a different day than usual, so hopefully that will come through in the podcast and get a lot of positive comments about that.
Yeah, we're not bringing our typical Thursday energy. It's the trademark Monday energy. So we'll see. We'll see.
Yes. It's nice to have some flexibility when you have things like a sick toddler at home that can throw chaos into your schedule.
Of course. Well, yeah, welcome back to the Sit and Stay podcast. Happy to be here for another episode. I believe this is our 6th episode. How time has flown.
Yeah, it's really fun to do the episodes and get some of this information that I've accumulated over all these years recorded. Otherwise, I wouldn't know what to do with all this information. So it's nice to have this outlet. Very therapeutic. Yeah,
it's actually a kind of a fun, interesting experience for me as well, because it's I've known that you've been building up all of this experience and knowledge over time, and it feels like an honor to be the person who is helping extract it, I guess.
Very good. Well, and it's a nice technique to start statements with what it feels like, because feelings can never be wrong. So especially we recommend in discussions with your partner to say, like, it feels like you're being mean to me. They can't say, no, I'm not, because you're just describing your feelings. So,
right.
Feel.
Now, how can we best leverage that for talking to an insurance company?
Good segue. And yeah, interesting and important topic today.
Yeah, so we wanted to keep the topic rolling on insurance. We talked a lot last week about what it even means to be in network or out of network, and the whole system around that. And this week we wanted to talk about, specifically for those that choose to be in network with an insurance provider, how they go about that negotiation and all of the ups, downs, left, rights of that process.
Yeah. And there's lots of misconceptions around this, and it's not something that's really spoken about in any type of training program to be a mental health professional. So, good to share some tips here.
Yeah. So just to take it from the top, in case anybody missed our last episode, I think it would just be good to do a quick primer on what is an in-network contract, why is it important for a healthcare practice to negotiate an in-network contract, and I'll let you go based on that.
Yeah, so an in-network contract, most people are familiar with this because when you go to see your primary care doctor, take a child to the pediatrician, you're going in there and knowing, okay, I just have a $20 copay for this visit, or perhaps you've signed up for a high deductible insurance attached to a healthcare spending account, so you're going to pay more, but you're going to be able to get some benefits to use tax-free dollars to pay for it. But as we've mentioned in mental health care, over half of the providers working in this field, and higher than that for those in private practice, just don't accept insurance. So not being able to use your insurance card for your patients means that they're coming in and they're going to have to pay a cash rate in order to receive the healthcare services that you provide to them. And like we mentioned last time, there's lots of reasons for doing this. Mainly, insurance companies don't pay what they should for the services of mental health care professionals.
Right.
And number two, it is time consuming / maddening / can be very difficult to get paid and even to deal with the insurance companies. So those are the two main reasons why a lot of people decide not to bother with them. And again, it's this supply and demand issue that there's so much demand for the services, it is not required. But all that as background, there are lots of advantages to actually get an in-network contract with an insurance company. I'd say first and foremost, letting patients, getting access to lots of patients who are really excited to just pay their copay or whatever is required by their health insurance. It can get you a lot of referrals just from people looking for mental health care on their insurance company website. And it's a faster way to build up your practice, and definitely the default on payments for people who have a $20 copay versus several $100s per visit is much lower as well. So some of the headache in dealing with insurance companies is definitely translated into headaches in collecting large amounts of money from patients. Asterisk, that can be lessened by collecting payments up front and other strategies. But it is nice to be able to accept some in-network insurance contracts in your practice. I think the other piece that a lot of people who are graduating seek advice from those that have been out a long time. And if you've been out a long time and never taken insurance, it's unlikely you're going to recommend that someone try to go in network. And so sometimes people won't even try to negotiate an in-network contract. And every time I've tried, I've always been pleasantly surprised of finding a few insurance companies that actually offer very reasonable reimbursement and are not that difficult to deal with. And then I'm always glad that I have at least approached and tried to work with different insurance companies. And the one piece that is important, most important out of everything here, is to know that it is a negotiation. Whether or not the insurance company says, these are our rates, take it or leave it, that's not true. You can push back on them and try to negotiate for higher rates. And it's a good business experience to learn how to negotiate rates regardless of the outcome.
So let's say I go and I am talking to an insurance company for the first time that I've never been in network with. What are the key elements that I should be focusing on when I go to negotiate my contract?
Yeah, and this goes back to hopefully you've done some work in setting up your charge master and rates for your clinic properly and making sure that those rates are set logically and reasonably. And as a general rule, my advice to people starting out with a practice is make sure that you're out of network, that your charge master rates are high enough so that if you give a discount to an insurance company or to a patient, that you're still making the revenue that you need to make in your business. So yeah, step one is make sure you've set your clinic rates to where they should be set. And then step two is go into, find who the biggest insurers are in your area, find out who you need to contact to get in network, and then go in and offer a discount on your charge master rates, maybe starting with a 25% discount. And then it's not usually too hard to justify some of those reasons, but the goal would be if you can get the insurance rates to come up to something that fits with your business structure and budget, that's where we want the ending point to be.
Got it. Okay, so let's say, all right, so, given that it is a negotiation, are there any kind of strategies that one can use to approach that negotiation with?
Yeah, and I was really realizing as I was speaking, I'm working in vaguer, there's this hesitation to throw actual numbers there because historically there were threats around these rates are private, don't disclose them to anyone, we'll drop you. There was stuff written in insurance contracts saying if you tell anyone about these rates, will pay you less and other things like that. However, I'm not sure that those threats are valid anymore, but at least let me throw some numbers out as examples. So let's say, for example, you charge, let's say you're a therapist, and for a 45-minute session, your quote, your desired rate is to earn, $150 an hour. So a very rough rule of converting hourly rate into yearly salary is to double that hourly rate. So if you're making $150 an hour, that's roughly a $300,000 gross salary per year. It's not totally accurate in mental health because you're not really cranking through 8 hours a day. It's more like 6. No. It depends on your stamina, where you're at.
Right.
But it's still a reasonable, quick calculation on your hourly rate. So for whatever reason, if you've sort of determined $150 an hour, if I can make that fits my budget for mortgage and bills and whatever else you need to live on comfortably, and what you deserve after many years of training. So then okay, I need $150 an hour. Hopefully your charge master is set to be roughly double that, so that if someone's coming in to see you, you're actually charging $300 an hour. And that's going to be your starting point for, say, a person with no restrictions on their means who can come in and pay whatever for a session with you. Then that fee would be $300 for that person. But within that, you're going to build in discounts for different various sliding scale factors, discounts for cash rates, etc. But the important point with insurance negotiations is if $300 for a 45-minute 90834 session is what you're charging, then you're going to go to them and say $300 is my rate for this, but I'm going to knock it off 25% if you go in network. And so that's going to drop it to $225. And then hopefully the insurance company will come back with, well, no, we're not going to give $225, but we'll offer $150, which is 50% of what the charge is. But you know that's what you need to live comfortably. So you're okay accepting that rate. And again, it's a very general business rule in some industries that there's like 100% markup on services. Years ago, when I worked for a sporting goods store, we bought a Frisbee for $3. It sold for $6. Gives you a time frame for when there was a $6 Frisbee. But and that's the same general rule in our business and in the negotiation. You don't want to say, hey, I charge $150 for 45 minutes because the insurance company is going to come and offer you, $90.
$75 or
exactly.
$90. Yeah, okay.
And then then you're in a harder negotiation standpoint. Yeah.
Okay. I mean, that is, I'd say, great advice that maybe, I don't know. I haven't read up on this topic super thoroughly, so I don't know if that's a common suggestion, but even just sitting here listening right now, if that, that sounds like, the golden rule that should be, plastered on the walls when you are exiting grad school. Hey, remember to, double it, or, that does sound like really good advice.
Yeah. And Parker, and my suspicion is that, people may go out and set their rate at, $250 or $300 for this service, and then go to the insurance company and say, here's the rate. And then if they don't offer that exact rate, they're just throw their hands up and give up. But that's the wrong strategy to take. So it's not scientific, it's not evidence-based, but in just personal experience over these last 18 years, set that charge master higher than what you expect. And then that gives you that negotiating room and power with the insurance companies.
Right. I mean, that seems to be the strategy for any good negotiation.
Right.
Yeah, makes a lot of sense. So, are there any other, before I move on to the next question, are there any other particular strategies that come to mind to, strengthen one's position for the negotiation?
Yeah, because of this law that passed recently around insurance companies have to disclose the rates that they're paying for different CPT codes. You
Right.
may be, now the law is there, but there's also been a lot written on how, despite the law, you still can't find these rates. So, but you may be able to arm yourself with information about what other people are getting in the area, what other large groups in the area are contracted with insurances, and finding out what they're able to get paid from the insurances. And because everything is a negotiation, there's often high variability in what 10 different practices in the same zip code might get reimbursed by a typical insurer.
Right.
Yeah. But, mainly knowing what you're willing to accept, and then reaching out to all the insurers in your area, because you might hit someone that gives you a reasonable number. It's a good starting point.
Okay. So on the flip side of things, if you're seeing somebody who has insurance that's not in network with you, but they really want to see you, typically, as I understand it, you would then go for a single case agreement with the insurance company. What can you further describe what is a single case agreement, and when might you need to negotiate one?
Yeah. So, and the single case agreements are a great way to maybe lead into an in-network contract as well. So a single case agreement is when you're not in network with a specific insurance company or any insurance company, but there's a patient that really wants to see you and you'd like to see them. And maybe you have a certain expertise or specialty for seeing this type of patient, or maybe you just have an appointment in the next few days. So different states have different laws around this, and we're lucky to live in California, where there is actually a law that insurance companies have to get you seen within 10 days for an urgent situation, mental health situation. And anyone in this industry knows that if you were to actually call the first 20 people listed on your insurance as being in network, 18 of them have moved. 2 of them are people at a university that just do research and don't see patients.
Yep.
So it's very unlikely that insurance companies can actually find someone to see patients quickly. So it works best to have an aggressive patient or parent of a patient to call the insurance company saying, this is a mental health crisis. We're supposed to be able to get care in a reasonable time frame. I have this clinician who's available to see my kid. They're not in network, but this is who I want to see, and I want you to pay for it, and you being the insurance company. An aggressive patient or parent, and I don't like using the word aggressive, but maybe persistent is better.
Right. Yeah, persistent.
Calling back daily, asking to be assigned a case manager, explaining, hey, I called the first 18 people on the list and none of them were available. That can often work very quickly for then the insurance company to reach out to you and offer a single case agreement. And over the years, we've been very successful, especially again, when you have a parent or of a child that needs mental health services or a patient who's good at advocating for themselves, of getting a single case agreement. And for single case agreements, once it gets to the point where the insurance company reaches out to you or knows they have a dissatisfied customer, you can often get very close to what that charge master rate is. So this is not a half off negotiation for rates. This is, hey, insurance company X, you're breaking the law. This patient is upset. Every state has an insurance complaint department, and They don't want to have a lot of complaints going into the state they're operating in. So they're much more willing to accept much closer to your charge master. And that 100% has been the case over the years with all of our single case agreements. And the reason that works well is if you manage to get a single case agreement for one patient with that insurance, and then you get a few more with that same insurance, it opens it up to go back to the in-network negotiation. And because maybe you've been getting 80% of your charge master rate, go to the insurance company and say, hey, we love getting 80% of the reimbursement for these handful of patients. Why don't we get a reasonable rate? That's 70% of the charge master, and then you don't have to do these single case agreements. And that strategy has worked over the years as well.
Yeah, I mean, that is all very interesting. A question that comes to mind is, I mean, this might just be for me. I hope it's useful to the listener, but I've seen in the past that you might have a different single case agreement negotiated. Like there might be a different amount negotiated with the same insurance company for different patients. So what I'm wondering is, because I've seen that happen, what I'm wondering is, why would the insurance company choose to, take a different rate based on different patients? And I think maybe I've seen that more often in intensive care, but is that anything that could apply to, seeing outpatients, and is that something to look out for?
Yeah, no, great comment. And well, the answer to that question is because everything is a sales negotiation. So insurance representative, they might be more sympathetic to getting the patient seen quickly, and so they're going to offer better rates. But insurance rep B, that maybe their bonuses are tied to, is going to try to negotiate the lowest rate possible. I think we've definitely learned now that once we get a single case agreement with a reasonable rate, we will not accept anything below that. So it's like and you can't. The way we tend to negotiate is, you guys gave us these rates for another patient. These rates are reasonable. This is what we expect. And occasionally there's a little bit of pushback there, but it is likely illegal. A comment with like, we don't see how it's fair that you would pay more money for our services for this patient versus another one. And so far that's been met with, okay, you'll have the same rates for all your patients. I think one thing I didn't mention yet that's important in the negotiations is, everyone working in mental health has tended to go through a lot of schooling and maybe have some different certifications and skill sets. Writing about all the schooling, awards you've gotten, certifications you have. Are you doing in-person services and not just telehealth? I think is a negotiation piece. All of that should go into the negotiation for why you deserve the rates you're asking for.
Okay, so something that I'm thinking about is, well, we all know the big insurance companies, but oftentimes, locally, you might have people who all take a particular insurance that, is very common in that area. That's not, a nationwide insurance company. How does the process tend to differ between, those smaller groups versus the larger ones?
Yeah, good question. And definitely in the counties we're at, you have some of the, largest nationwide insurers here in California: Anthem, Aetna, Optum, Cigna, or Evernorth. But then there has been a rise in what's called ACOs, or Affordable Care Organizations. And this is where maybe a smaller healthcare system, in California, we have Sutter Healthcare System, or there's some counties that have medical facilities and put together a healthcare system where they can charge county employees a much lower rate if you accept to get your health care through our county network. And these health plans, whereas, the big companies insure millions upon millions, some of these might be restricted to people within the county they serve, and it might just be 40 or 50,000 people who are on the health insurance panel. What's nicest about negotiating with these groups is I think you get a very personal connection to the person that you're negotiating with. So it's usually not as big of a bureaucracy. It's not 5 levels removed or complicated to figure out who actually the medical decision maker is. And so it's always nice just on a more personal level to reach out and say, hey, I'm here and I'm providing care in the area of your system or your geographic region. And you just like to come up with some reasonable rates to provide services for your members. And it tends to be a much more reasonable and individualized negotiation, which is nice. Sometimes the smaller insurance groups I think this is better now, but historically we had a group where you still had to do paper claims, even though other groups were all electronic. I mean, they've moved up to electronic claims more recently. There might be a few more headaches with getting some payments or things like that, but in general, it tends to be a healthier negotiation with some of these smaller insurance groups. I would say that also it reminded me that a lot of insurance companies are looking for, or quote, say that they're interested in providers doing evidence-based care and measuring outcomes. I'm not sure that I've seen that too much in being relevant in the negotiations with some of the big payers. However, I would say that with the smaller groups, if you can show that you're tracking how the patients are doing, and of course with RipsyTech, we have very simple, you can send your patients these 4 questions a month to get a nice visual graph of how they're doing, both to discuss with them and to make a summary graph for insurance companies. Those arguments about the care you're actually providing seem to be more helpful with the smaller insurance groups.
Gotcha. Yeah, I mean, we are very proud of those features. I mean, in my mind, it only makes sense that tracking outcomes over time is such a crucial thing to know if you're actually making a difference. And I would hope that the bigger insurance companies would place more value on that as time goes on. And hopefully, as part of our mission with RipsyTech, we are trying to make measurable outcomes, a bit more transparent for providers that like to use that. So, hopefully, it's all part of a peaceful and educated revolution towards more evidence-based outcomes.
Yeah, and I would say, Parker, also talking about doing evidence-based outcomes can be helpful at the beginning, but another strategy we've employed at times is to accept a low insurance rate, but get a built-in yearly percent increase. And I think we talked about this a little bit before. So even if a rate is low at first, if an insurance company agrees to a yearly 5 to 10% increase for a number of years, that might make it worthwhile. It's also important to let people know that just because you're in network with an insurance doesn't mean you have to take all the patients that get referred to you from the insurance. So there is something called a payer mix to your practice where you keep track of, I have this many cash patients, this many sliding scale, and this many with these 3 different insurances. And you're ultimately going to balance that out so you hit that income that you need. But want to make sure if you sign up for an insurance company, you're not obligated to see any one of their patients that reaches out to you. And that's important to know.
Gotcha. Okay, so before I move on, are there any other comments or anything that we might have missed that would be good to touch on?
No, I would think I would just mention that, yeah, if anyone, as we offer with Ripsy, with this free business consulting, financial advice, anyone who's using our product can definitely reach out to us and get very specific letter templates and negotiation discussions on how to approach insurance companies in their area. And I'm always happy when I see a colleague has done the work to try to negotiate with insurances and gets a fair rate. And yeah, it helps their business and is good for those patients who can then use their insurance.
Absolutely. So before we wrap up, I don't think we discussed this ahead of time, but do you have a mental health business moment of the week?
I do have a business moment of the week, and it's it's one of these situations where every clinical provider has something called a NPI number, National Provider
Index, I believe, or identifier, National Provider Identifier.
I think identifier. I was thinking index also at first, but identifier is correct. And
10 points.
It's something you can Google. You can Google your own. Most people know their own NPI. And we had an issue where one of our new providers' NPI, I don't know what the total back-end issue was, but either the agency NPI or this provider's NPI was attached to some random clinic we had never heard of.
Oh.
And it just created... So when you're going to look for claims, you normally see the provider name listed there. And instead, we saw this ambulatory surgery center listed and couldn't even really find if this was an active center or anything to that effect, but it required sort of talking to 5 different people about, hey, we submitted these claims, triple check to make sure there was no errors in the NPI numbers, but this surgery center is showing up and we're a mental health agency and, quote, they say they're working on this and we'll get this fixed. It is still pending, but
oh, wow.
I think that was a new one to see a random ambulatory surgery center show up as billing these mental health codes.
And how many days has this been ongoing?
Let's see. We're pushing 3 weeks now.
Oh, gosh. Okay.
Yes. So I think that the NPI number issue is corrected, but so now it's this matter of, okay, well, all these claims that went to the wrong place,
Right.
will we be paid correctly and how long will it take? That is the question.
Gosh, well, I'm going to have to note that down to get an update for the future.
Very good. Very good.
All right. Well, I think now would be a great time for us to wrap things up. Are you, does that sound good?
Sounds good. Yeah. Looking forward to our next podcast already.
Yeah, this was a great episode. We'll be recording in just 3 more days. So
That's right.
Well, on our end.
Yeah. And we're, and here we, just a reminder for Parker to talk about, we would like specific questions or if people want to reach out.
Thank you. I was just thinking about my closer. Yes, if anybody wants to reach out and send us any questions, you can do so by reaching out to sitandstay@RipsyTech.com, or we have a phone number and a general email on our website. You can reach out to us there. Wherever I get a question from, I would love to answer it. So I think, next episode it would be great to answer some questions.
Very good. Very good. Thanks, Parker.
Awesome. Well, I'll see you later, Tom. Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.